as we talk about COVID vaccine, we have to talk about, as we talk about its confidence, we have to talk about COVID vaccine hesitancy. And often there are marginalized, unrepresented communities. There's Black, Indigenous people of color, communities who really have apprehension and mistrust about the vaccination. So what are the strategies that we may employ so that we can make sure that we engage those communities and support them and provide the education that they so rightly deserve? Dr. Koltai, can you add?
Yeah, I'm going to give advice for both providers, if there's any providers on the call, and for patients as well. So as provider, I would say make sure to continuously be aware of any particular biases or any sort of potential any biases that you have, and making sure you're creating a safe space and environment for your patients to bring concerns that they have. Please listen to the concerns of your patients and realize that it's maybe just not a negative experience that you may give them, but another provider also may have given them. So it's really important for providers to continue to build trusted relationships with your patients, and being transparent and open and have that conversation is absolutely necessary. And for patients who are feeling this, I can say that even as a person of color myself, I've had negative experiences with healthcare providers. Some have been really great and some haven't. And I know that can impact my own trust and whether or not I trust that person. And what the bits of advice I gave is one, it is okay to always get a second opinion if you feel like you're having a healthcare provider that is dismissing your concerns. And it's also really important to be an advocate for yourself, right? It is important to make sure that you know your body best, right? So if you're having a particular symptom and you want to be able to talk to your doctor about that and continue to build the trust, and if you're finding a doctor that's dismissing you consistently, then it might be time to find a doctor that does listen to you. Just because the experience of one doctor or a few bad doctors does not mean the entire field is out is malicious. There are so many wonderful healthcare providers that want to listen to you and want to help you. So it's really important to continue to build that trust on both ends, while still also making sure you have your health in line. And now, and I understand there are so many terrible stories that we have heard about people's concerns are being unheard. And again, your advocacy, finding the right healthcare provider that's going to listen to you, I think is always going to be the best option. And I know that's hard. That's really limited advice for a really large, complicated problem that is happening in society. But it is the most I could talk to you about now in 30 seconds.